talking about the indications and the pros and cons of incision versus non-incision double eyelid surgery. There has been many questions regarding whether a patient will need an incision to create the double eyelid crease or fold, or whether a suture technique or a non-incision technique can be performed. So first, I think we need to discuss what kind of patients will need an incision and what kind of patients can have a double eyelid surgery without an incision. Simply put, an incision technique will be applicable in older patients where there are significant excess upper eyelid skin that has to be removed. The other indication for an open or incisional double eyelid surgery is if a patient has ptosis. And ptosis is when a person has a weakness of the eye elevating muscle. And traditionally this has been corrected with an open technique because it gives an access for the surgeon to manipulate the muscle to give it power and strength. The pros of the open or the incisional double eyelid surgery is that it is a easier surgery for a surgeon in terms that it gives us access to the deeper eyelid structure. Therefore, for patients, especially with ptosis, surgically it is easier for the surgeons to make an incision and to correct the weakness of the eye elevating muscle, also known as ptosis. However, the disadvantage of the incisional double eyelid surgery is that it leaves a scar. And this scar is permanent, and the scar should be made only if the person really needs it, such as if there's a significant excess upper eyelid skin that has to be removed. Because this scar is noticeable, and even with makeup, one would have to really apply heavy makeup to cover the scar, especially if one takes high resolution photographs. The advantage of a non-incision suture technique double eyelid surgery is that essentially there's no incision, and therefore there's no scar after the double eyelid surgery. Also, the advantage of a non-incision suture technique double eyelid surgery is that it follows the natural curvature of the orbicularis muscle, in that it follows the path where the fold naturally wants to go. Therefore, the fold creation is a natural fold, and is a fold that one would have had if they were born with a double eyelid fold. Now that we have talked about the indication for an open or incisional double eyelid surgery, and then we also talked about the advantage of a non-incision double eyelid surgery in that it doesn't leave a scar. So let's review. Again, people with excess upper eyelid skin, or for patients with significant ptosis, would need traditionally would need a incisional double eyelid surgery. However, now let's look at patients who are young, who do not have excess upper eyelid skin, and who may have ptosis that is not so severe that it can be corrected possibly with a non-incision. And to do that, and also besides that, I think we should also explore patients who just want double eyelid surgery only. These are young patients who are coming in, and for aesthetic purposes, they would like to create a double eyelid fold. So for these patients, which are majority of the Asian patients who are coming in for double eyelid surgery, who only want double eyelid crease formation, then the discussion of whether an open versus non-incision, open versus non-open technique would take us to a deeper understanding of how to create the fold. Traditionally, the folds have been made by creating a scar. Scar being creating a trauma to the eyelid tissue so that tissue would adhere to each other to create the fold. However, advancements in wound healing and surgical techniques and healing process have allowed surgeons to understand that scar is not something that we would like to create if it can be prevented. Especially for eyelid region, which the thickness of the eyelid is so thin that having a scar creates palpability, and it creates another dimension to the eyelid where a natural double eyelid crease or people with double eyelid fold does not have a scar. It's not hard. It's just a crevice where it's a crease that is formed. So therefore, we need to create a crease, not a scar. So in the past, the incision was made because there were difficulty creating the crease without the scar. But with the advent of a non-incision suture technique, many patients, especially young patients, can achieve double eyelid crease without having a scar. So the non-incision, also known as suture technique double eyelid surgery, really made big progress with advent of minimally invasive surgical techniques. The concept of a minimally invasive surgical techniques is to actually do what surgeons would typically do without creating significant incisions, and trying to minimize incisions and minimize trauma to the underlying structure. However, to perform these techniques, the surgeons would have to have a deeper understanding of the concept behind minimally invasive surgical techniques, or would require specialized further training in this field. In double eyelid surgery, minimally invasive surgical techniques is applied to create the fold by using a permanent suture to create the fold without creating a scar. And now the further advancements have been made so that even toasted surgery can be performed using a minimally invasive suture technique. And there's a misconception that patients who are heavy lid or thick lid or fatty eyelid will need an incision. And this is because if a simple standard suture technique, double eyelid surgery, is performed, then the fold doesn't occur as well, and there's a loosening of the fold. However, with a deeper understanding of tension application to the soft tissue concepts, a suture technique can be applied to young patients with puffy, thick eyelids with significant fat accumulation. For these patients, they can definitely receive a non-incision suture technique. So because of the three factors, the deeper understanding of the double eyelid fold creation, in that we don't want to create a scar, it's a crease, and that's what we're trying to mimic, a natural crease. And number two is that advancements of the minimally invasive surgical techniques, and the third is with a understanding of tension application to soft tissue, non-incision suture technique is now applicable to most of younger patients who do not have excess upper eyelid skin. So therefore, the indication has broadened for patients with thick, puffy eyelids or patients with ptosis. So these patients can also now receive a non-incision suture technique double eyelid surgery.